Welcome back. I'm now joined by the Vice Chairman of Manipal Hospital, Sanjeev Bagai, the Chairman of the Institute of Critical Care at Medanta, Midi-City, Yatin Mehta, the former Health Minister of Delhi and Congress spokesperson Kiran Walia, BJP National spokesperson GVL Narasimha Rao, and Aam Aadmi Party spokesperson Saurabh Bhardwaj. Dr. Bagai, let's start by trying to understand the size and scale of the dengue crisis in Delhi. Over 2,000 people have so far got dengue, and at least 15 by last official count have died. Is this now, in your eyes, becoming something of epidemic proportions, or is it exaggeration to use the word epidemic?
I would still say it would be a kind of an exaggeration to actually call it as a medical epidemic. But because you need a given percentage in a given size of population. And the difficulty in actually medically calling it statistically as an epidemic is because a vast majority of the dengue infections are mild infections, they are subclinical infections, one-day fever, and the patient recovers automatically. And even if the dengue is presenting itself in a moderate or severe form, almost 90-95% are very self-limiting illnesses. Practically less than 5% require true medical care, and only 1% really land up in the ICU or require intensive care. But having said that, this is much more than what we have seen in the past few years. We have seen various variations, perhaps because of the virulence of the strain which could have changed in the dengue virus. We have seen patients having a lot of non-fever symptoms like abdominal pain, a lot of severe headaches, body pains, joint pains remaining for much longer than what it was till a few years back. And we haven't seen that drastic drop in platelets, but we have seen more number of cases clearly than for many years we have seen in the past.
Now, Dr. Mehta, dengue, of course, isn't just limited to the capital, Delhi. Today's Hindustan Times paper says that as of the start of this month, there are 19,704 cases nationwide, and the nationwide death toll could be as much as 80, even 81, 82. Nearer Delhi, you have 1,149 cases in Punjab, 542 cases in Haryana, and again, by the official count, 2 deaths in each of those 2 states. So could this be a much bigger nationwide problem than we've as yet accepted and acknowledged?
No, it is, Karan, because the actual number of cases are more than what is being reported officially. Because the criteria for labeling it as dengue are pretty stringent. At least in Haryana, it has to be IgM positive, only then we can call it dengue. And if it is NS1 positive, they do not qualify as dengue. So actual number of cases would be much higher than what is being officially reported in the government database.
So then there's a very interesting point you made that actually you're saying because of a certain technical definition adopted by the government in Haryana, many cases that you think ought to be reported as dengue are not being reported, and as a result there's an under-reporting happening. Have I understood that point correctly?
No, that is correct, but I think that is also applicable other places also, because official reporting is not fully correct. The actual number of cases are much more than what is being.
In which case, can I put to you the question I put to Dr. Bagai? Would you say that we now have a situation that approaches epidemic proportions, or would you say that's an exaggerated way of describing it?
Yeah, Dr. Bagai was right. It is not actually epidemic, but it is called hyperendemic. That is when there is an endemic going on around the year, there is the disease is there, and then suddenly the incidence of that disease increases, which is called hyperendemic. So it's more than endemic but less than epidemic.
More than endemic but less than epidemic.
For worry.
Dr. Walia, yes, you've been Health Minister in Delhi. Your government was in power for 15 years, during which you had several dengue crises that you had to contend with. Do you think that we perhaps don't have a full grip on the actual number of people suffering dengue, or sadly on the number of people who may have died? That the actual reporting system, the actual system doesn't cover both the sufferers and the dead adequately enough for us to be accurate.
You're very right. We do not have a system in place where you can be totally accountable for what number that you're talking about. And that is why, and I mean, you know, like people go to small nursing homes in slums where the incidence is very high. They go to doctors who are not really qualified to be doctors. There are so many cases, and as the gentleman was just saying, that there is that rapid test which just say that yes, you have been infected by a dengue infected mosquito, but doesn't really qualify to be a proper dengue patient, and you're there but yet not there. So these technical issues are there, but dengue is near epidemic, as I understand.
You would actually use the word near epidemic.
Yes, because we would be confronting a situation if the monsoon comes as it's being predicted, and then the whole mosquito is going to flourish.
You're saying a very important thing, Mrs. Walia. You're saying, A, because our reporting and our method of testing is not perhaps the fullest and the best, there is under-reporting. And the second thing you're saying is because many of the poor don't go to proper doctors, don't have access to proper hospitals, they could be sufferers, worse still, they could be dying without the figures officially telling the story.
Exactly. I would like to make a point here. Having known that, we realized, especially when swine flu came, and it was the first time we had to confront a situation, there was no history, we had nothing to learn from the past, but we went and invoked a provision which was prevalent when India was infected by plague in the pre-independence days, where it was mandatory for every agency to report to the government, for every patient to be on record. That's the only way we could get the number of patients infected by swine flu, which was highly contagious. Therefore, this kind of reporting is not happening. Secondly, and you know, these small nursing homes, and what is the method, how the report is collected every evening. Now, the second point that I was making is, therefore, it is linked with a situation when it is near epidemic, that are we prepared for it?
Let me first quickly get a medical confirmation about a particular point made by Dr. Walia, a former Congress health minister, before I come to the two other politicians. Dr. Bagai, what you heard Mrs. Walia say is that because many of the poor end up going to improper doctors, I don't want to use the word quack, that sounds pejorative, not fully qualified doctors, because many don't even have access to that, would you accept that the actual incidence of dengue as well as the death toll would be a lot higher than the official figures record? Because that's what Mrs. Walia, who's been health minister, firmly believes. Would you agree as a doctor?
Yeah, Karan, I'll just take a minute here. I think what Dr. Walia has said is entirely true, and this is what I had just touched on in my introductory remark. A lot of the cases of dengue or suspected dengue are subclinical. Very often the tests are not done, or they are done and they are not actually jotted down in the epidemiological survey. Point number two is a lot of patients go to non-qualified doctors. The quack still exists in Delhi NCR region, and there is no way ever that you can document the exact statistics. Point number three is, very often what we have seen is that we take NS1 to be positive and we treat a patient or suspected patient like dengue, and we don't then subsequently keep repeating blood tests of IgG and IgM. So there is a clear case that there may be an underreporting. And last and most important is that a host of viral infections appear like dengue, but the test comes negative. So this is what we call as dengue-like illnesses. So overall, if you look at it, the exact real picture, the authentic picture, would be a lot higher than what is reported, very clearly. I mean, if you pick up just 20 busy physicians and pediatricians in Delhi, you would probably get a number of more than 2,000 what perhaps is being reported. The epidemiological reporting in India sadly suffers not only in dengue but perhaps in most of the medical conditions, because one, we don't have a protocol in place where the reporting occurs or it's made mandatory. Two, the coding of the diseases is not available in every hospital and every private clinic. Unless and until the coding occurs, we will never capture the exact data. It is impossible.
Okay. Mr. Bharadwaj, let me bring you in. There was a point made by Mrs. Walia. She was referring to, in fact, how they handled the swine flu epidemic when it happened a few years ago. And she said that they implemented at that point in time a law that perhaps goes back to pre-independence days when plague was a concern. Enforced reporting by every clinic, by every hospital of every single patient who comes in. Do you think the time has come to do something similar today with dengue in mind so that you have a better idea of the extent and scale?
I'm not sure whether the government still is doing it or not, but I'm sure that if it's a good idea, it can be taken up. There's no harm in learning from it. And whatever you were saying about the pan-India situation, I also saw some media reports where they're saying, like, in Karnataka itself, there are 3,600 cases of dengue, out of which 10 deaths have been reported. In Bangalore itself, 1,800 cases, 6 deaths. In Maharashtra, 1,378 cases, 4 deaths. Mumbai, there are 390 cases. So in Telangana itself, there have been 28 deaths which have been reported about dengue. So I think it's a pan-India phenomena and everybody has to work together for it, and it's a serious problem.
And I applaud you for accepting so openly the suggestion made by Mrs. Walia. Normally politicians have a tendency to oppose what an opponent suggests. I applaud you for having accepted it so readily and openly. Mr. Narasimha Rao, the sort of situation that exists is bound to create some sense of fear, maybe even some sense of panic, as a result of which many people who have just ordinary fever will end up worrying whether they actually have dengue. And that potential for panic, presumably, will make the situation worse, because it A, frightens the population, and B, it adds huge, perhaps even unsupportable pressure on the limited resources we have. Do you worry that panic could add to the problem sizably?
Karan, there is already a panic that has broken out over the last few days, and mainly this is a result of lack of proper public awareness, proper communication to the people of Delhi. I think there are a lot of steps that the state government has been taking over the last few days, and the central government also, the central health minister also had been in touch with the Delhi health minister, advising many steps to be taken. But you see a lot of knee-jerk reactions happening now. While I would not really want to make any political comments on this topic, but certainly a bit of better preparation and a lot of initiatives, say back 4 months back or 3 months ago, could have really saved the situation. You already have a panic where everyone having fever fears it to be dengue, and they want admission, and in the absence of facilities for admission, there is a furor that you already see. I think even at this stage, I think the communication and public awareness are still not up to the mark. And this is an area
let
where
me
the
stop you
government,
there.
I want to
I want to take up what you're saying. Let me stop you there. I want to take up what you're saying about communication as one of the key steps that need to be tackled now, particularly in view of the fact that dengue could peak as it normally does between mid-September, mid-October. I'll come to that in a big way, I promise you, Mr. Narasimha Rao. But first, very quickly, let me go to Mr. Bharadwaj and put something else to you as a politician, and then I'll come back to the doctors. What about the media's almost 24-hour coverage of the subject, which has been happening on channels and newspapers for the last 5-6 days? In your eyes, is it increasing awareness and therefore forcing politicians and hospitals to act, which is a good thing? Or is it also fueling apprehension, creating fear, and leading towards a sort of panic fear psychosis? Which of the two is it? Or is it a bit of both?
Frankly, it depends on program to program. There are some channels which are showing, that, people are running for beds, they don't have beds, and there are people, showing a sad story of somebody losing their kids. I know that spreads awareness, but, that brings a lot of panic among the people that, my son, my daughter also has a dengue, so I must rush to the doctor or rush to the hospital, or she or he may end up dead. So I think it depends on program to program, but frankly, very practically, today the government's problem is that, like our health minister said, 80 to 85% people who have fever and coming to the hospitals do not have dengue. But out of fear psychosis, out of panic, they are just coming to the hospitals. And I must add that the World Health Organization says that the bed to population ratio in a country should be like 5 beds per 1,000 people. In Delhi, this ratio is 2.7 beds per thousand, and it's a reality. A government cannot overstretch the beds. Like overstretching also has its own limitations. The Delhi government has 10,000 beds. You can overstretch it by 10%, like 1,000 beds. But if there is so much of panic and everybody starts coming to hospitals, I think the situation becomes out of control. So I think it's a mixed feeling, but it depends on programs. There are some programs which teach people, which make people aware, but there are some programs which are just spreading panic. I'm so sorry to say.
Dr. Mehta, let's come to some of the steps the Delhi government has taken. 1,000 new beds will be added in the next few days. I believe the deadline is Sunday. That's only in government hospitals. Separately, private hospitals have been asked to increase their beds by something between 10 and 20%. Thirdly, a flat fee of rupees 600 has been fixed for the ELISA test. And finally, doctors working in dispensaries have now been asked to work in government hospitals to help with dengue. How adequate are those responses from the Delhi government to the fact that this is the situation today which is now panicking people?
See, these are all knee-jerk reactions and with a lot of populist undertones. I think they should have anticipated. This is not God's wish that dengue has suddenly hit India. It is expected during September, October. It happens every year. They should have anticipated and taken measures to do that. How does suddenly a hospital double the number of beds which it has? I mean, these are unrealistic expectations. Also, fixing a fixed rate for this thing. Now, somebody has overheads. How do you expect private clinics to do? They may not make profit on it, but at least the cost should be realistically covered. How do you expect them to absorb the cost of what the government is supposed to do?
Can I interrupt you there? Can I interrupt you there? Dr. Mehta, are you saying that the cost of 600 fixed for an ELISA test is actually not even covering the cost to the hospital, and therefore the hospital will be doing the test at a loss? Is that what you're saying?
Absolutely. 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 I mean, it is unrealistic. And I think also suddenly expecting people to increase the number of beds, suddenly telling doctors just to treat every patient who walks in. I mean, these are unrealistic things. They should have anticipated, taken the measures to prevent these things, spread education, which what they are supposed to do, which nothing happened to that. And then suddenly now you've got a fire, you're trying to put it off.
Okay, I'll go back to Saurabh Bhardwaj and give him a chance to respond to you. But let me first get in Dr. Mehta, and then maybe Saurabh can respond to both together. Dr. Bagai, according to the Indian Express, Delhi has a total capacity of 50,000 beds, which includes 10,000 in Delhi government-run hospitals, 20,000 in private hospitals, and a further 30,000 in hospitals that are run either by municipal corporations or by the central government itself. With the planned increases, the total should go up by anything between 3,000 on the low side and perhaps 5,500 on the high side. Given that dengue could be peaking now in the next 3-4 weeks ahead, because traditionally the peak period is mid-September to mid-October, is this sort of increase in hospital beds sufficient?
Actually, Karan, we are looking at one end of the problem. The easiest thing is to buy a bed and put it in empty spaces in the hospital. That's clearly not the answer. Where is a rationalized approach for the human resources, for the human intellect? Now, in Delhi we have about 41,000 beds, out of which about 24,000 are non-private and 18,000 are private. We can't wish away the other diseases. So there are cardiac emergencies, there are trauma, there is neurological and oncology cases, there are births, there are pediatric routine admissions. Now, obviously the system is already overstretched. With this dengue outbreak, which a lot of patients actually do not require admission, but under the fear or panic or whatever we may call it, are reaching out to hospitals, the system is already overstretched and now it is bursting to a stage of being collapsed. We don't have adequate amount of nursing staff. We don't have adequate amount of doctors. So for me, just adding on a bed is not a knee-jerk reaction. It's a complete foolish error. First and foremost, what they need to do is to rationalize, one, what is the bed availability across the state? Point number two, what is the rationalized manpower availability? We need qualified technicians, nursing staff, doctors, resident doctors.
Can I
and
interrupt?
most importantly, as far as this is concerned...
Can I interrupt? You're pointing at
Sorry?
the major... Can I interrupt?
Yeah.
Your point is that you're talking about the major lapses in terms of technical staff, nursing staff, doctors, facilities. But those aren't things that the government can actually help you create for an emergency at breakneck speed. Given that you now need to respond at once...
That's exactly what the point... that's exactly the point which I'm trying to make, is that just adding on the beds is not an answer. By adding 10% extra capacity to a running existing full hospital is not an answer. We will give a compromised care to the other patients. So what we really need is rationalized bed availability. We need more rationalized manpower availability, and these are doable things. These are not, this is not rocket science, this is not something which is undoable, but someone needs to sit with the government and private players together as a steering committee or a core team and say this should be the action plan for the next 1 month. But having said that, Karan, what is really important is what I would like to see from the state government is a next 5 years rollout plan.
Let's leave the next 5 years. Let's leave the next 5 years till we've overcome the crisis of the moment. We can come back to the next 5 years after that. Let's keep our focus on the crisis of the moment. Saurabh Bharadwaj, you heard Dr. Mehta make a critical point and you heard Dr. Bagai make a second one, and I want to put both to you quickly before I come to the other politicians. Dr. Mehta says that you fixed a cost for the ELISA test of 600, which is not even going to pay for the actual cost the hospital incurs. In other words, you're asking hospitals to cost or to do the test at a loss. That is an irrational thing to do. And the second thing you've heard Dr. Bagai say is that instead of coming up with what he calls knee-jerk reactions, you need to call together experienced doctors like himself and Dr. Mehta, create a core committee that sits with you and medically advises you about the key steps you need to take between now and the next 1 month. How do you respond to those 2 points?
First of all, in times of crisis, I think everybody, including me, you, Satyendra Jain, and everybody, who is a doctor or who owns a medical, institution, should think about the social aspects of their profession and should not, at least for a few days, you should not think about the commercial aspects. I do understand everybody has a right to earn profit, but however, in times of crisis, I think everybody should start think about bigger things.
What about Dr. Bagai's point? What about Dr. Bagai's point?
After, taking feedback from lot of people.
Sorry about that. I understand. We all accept your point. What about Dr. Bagai's point? Come to Dr. Bagai's point.
And Dr. Bagaya, I have been a management consultant for 10 years. I can use all the buzzwords of rationalization, human resources and all those things. But at the end of the day, you have to respond within days. You cannot call for conferences with the doctors where we sit in the air-conditioned rooms and talk about 5-year plans for rationalization. The sad reality is, in Delhi, the Delhi government has got just 10,000 beds. And we cannot deny anybody medical care. This is what government is supposed to do. You may call it a knee-jerk reaction, but I think this is the best what we could think in this situation. If there is any feedback, but it should be a constructive feedback. It's all welcome. Dr. Bagaya can always write it to us. He can call me. He can meet me, he can give his suggestions. We are ready for all the inputs.
Actually, he is. He's giving his suggestions to you in public on this show. So hopefully you're hearing. But let me take up a point made there by Saurabh Bharadwaj, and it's one that you would have some insight and knowledge of because you've handled crises in Delhi with swine flu. He says, the government is in a position where as politicians they have to react, and they have to react immediately. They don't have time to call committees to sit down. On the other hand, and this is equally true, politicians are not experts. And the Aam Aadmi government has never been in government before, and I'm not criticizing them, but they therefore lack experience. Therefore, should politicians find a way, even when there's a crisis, of bringing together the best expert opinion, like doctors, like management experts, to say, look, we have a crisis, what do we do for the next week, the next 2 weeks, the next month? You've been a politician, don't give the reply of an opposition leader, give the reply from your experience.
Yeah, I've always said that I don't know, you see, because you have a chief minister who's been an IRS officer, the bureaucrats often guide us, full stop, commas, everything. but there has been definitely criminal neglect of what is coming ahead. I would say criminal,
but
because somebody
let's
else
not
is
go
having
into
to
that,
pay the
because
price.
that's the past
But no,
now.
I'm just saying that therefore to say that a knee-jerk reaction is like required and it happens, it need not have happened.
But that we know.
having that
Now
it's
we have a
hap-
situation
but now
that has occurred.
now that it has occurred, it is still important because the next phase may be very critical. And if the next phase is very critical, somebody who has suffered from dengue once gets another attack.
So are you therefore saying that people like Saurabh Bhardwaj and the Health Minister Satyendra Jain must call upon the best medical and managerial experience?
And as you very rightly asked, if we had done this, and Dr. Bagai and all know about it, we had called all these hospital heads and asked them for their support, and let me tell you, it was very, very forthcoming. And even the MCD
And it was and therefore, as a politician, you found it helpful to get an expert opinion rather than say, I have to decide on my own.
Exactly, because I knew that mine would be a very limited intellectual resource and experience.
Very quickly, Mr. Narasimha Rao, and I don't say this in any way as criticism of the Aam Aadmi government, but I am saying it as a reality in a fact that none of them have ever been in position of governing a city-state like this before, except for the 49 days they had last year. Secondly, all governments, when they're inexperienced, have a problem handling a crisis, and you have a crisis on your hands here. Why doesn't the central government, without making a political issue and without scoring points, that's very important, offer whatever assistance, experience and resources it can? After all, this is not a time to score points. This is a time to help for Delhi. Would you be prepared to do it? Don't score points, but offer your help and do it quietly.
Karan, I think that's what the health minister at the center had been doing over the past 4 months. Ever since, I think even before the summer's onset began. I think the central government is willing to extend all possible help. It's already been doing it. You see, this did not require a great governance experience. All this is required some amount of preparatory, some work of preparatory nature, which was not done. But we have a crisis on hand now. Whatever assistance they require, I think the central government is prepared to extend that help. But we have a crisis on hand, and this has to be dealt with maturely and carefully.
Can I make a suggestion? Can I make a suggestion?
A lot of experience
Can I make a suggestion? I'm
already
interrupting you, but
in
can
the
I make a
public health
suggestion?
sector.
Why doesn't Mr. Nadda pick up the phone and ring up Satyendra Jain without publicizing it to the press that he's doing so, and say to him, look, whatever assistance you need, I can make available. I would like to be able to send so many members of my civil service to you, so many doctors, so many facilities, and give you extra money. But he doesn't have to let the world know he's doing it. Is he prepared to take that step without claiming credit and without scoring points?
No. No, I think this he has been doing already. The fact that you don't know is the reason is this has not been publicized.
Okay.
And this need not be publicized. So
and it should not be. And I won't do the tricky thing. And I won't do the tricky thing of asking Mr. Bhardwaj whether he's aware this has been happening and has been happening quietly, because that would actually create a polemic and a problem between the two of you. Mr. Bhardwaj is smiling, but very possibly nationwide as well. Let's come first, Dr. Mehta, to some of the clever, innovative things that hospitals have done. Gangaram has set up tented clinics for dengue patients. Do you think out of that book what we need now, particularly because people are panicking, is small community-based, mohalla-based, accessible clinics so that people can come, get tested, get advice and go back? Should that be something that hospitals and perhaps local governments jointly set up?
Absolutely. I mean, even the government can take help of all the private hospitals also. We'll be quite willing to participate, and let the doctors and the nurses go to the areas which are more likely to have dengue, which are the lower socio-economic strata, where there are more dirty water collected with the mosquitoes. And even the simple blood tests to do the basic diagnosis can be done there only. So that will decongest the hospitals and reduce the panic.
You're saying something very important. You began by saying, Dr. Mehta, that hospitals, particularly private hospitals, will cooperate with the government in setting up these small community mohalla-based clinics. Give me a quick yes or no.
Absolutely. Absolutely. We would be very happy to do that. Yes.
Mr. Bharadwaj, you've just heard Dr. Mehta say that private hospitals like his would be very willing to cooperate with the government to set up small community-based, mohalla-based clinics so that people who are worried can go get tested, get the best medical advice, and they then don't have to go to hospital. Will the government reach out to hospitals like Dr. Mehta's and say, come work with us, let's set these up?
For sure. I think it's a welcome move, and the government would be so happy to work with the private hospitals to set up such things. I'll straight away, after from your show, I'll straight away, call our health minister and get them in touch with the hospitals. If we can start it, I think it would be the best takeaway from Karan Thapa's show.
Well, I'm very glad that we're coming up with credible suggestions. I'd like to make another one and put it to you, Dr. Bagai. The Indian Medical Association today issued a public advisory that every dengue patient doesn't need hospitalization, and secondly, that a fall in platelets is not necessarily always a cause for concern. But beyond the IMA informing and advising and guiding the public, has the time come for the government to take out huge advertisements in papers? More importantly, to organize mohalla and locality meetings, particularly in the poor parts of Delhi, so that people can be informed? And thirdly, perhaps has the time come for circulating well-printed leaflets door to door, so that people know what to do, what to look out for, how to respond, and also to be advised not to panic? Do we need to go down that route to ensure people are aware and informed?
Absolutely, Karan. I think 90-95% of dengue patients don't actually need admission. There is a full concept of home care. I think that's something which every hospital, government and private, needs to focus on. The RWAs will be ever willing, the community centers will be ever willing, outreach programs can be set up. I agree, we don't need to sit in AC rooms, but I think proper planning prevents poor results. And that's exactly what has happened. We haven't planned properly. There is no divide between government and private setup. I think any doctor, any medical professional will be very happy and contribute as much as we can. We can decentralize and decongest the hospitals which are bursting at its seams. What basically advice is required is good hydration and control of fever. That's primarily can be done at home. But having said that, what is most important is public awareness. Public awareness can come through television, through FM radios, through leaflets, through newspapers. I think a message needs to go to the public. One is not to panic. Two, what are the danger and warning signs? And three, not to worry about platelets. I think somewhere down the line, India is just hooked onto platelets and therefore papaya leaves and so on and so forth. It's a rising hemoglobin which is more critical.
Absolutely.
Hemo concentration, shock syndrome is more important.
I'm stopping you because the point I'm pursuing is not about platelets. I'm pursuing the point about how do we actually get information, advice and guidance to the poor in particular. You have experience because you ran Delhi. This is a crisis for Delhi. Would you be willing to put politics aside and share your experience with the Aam Aadmi government, particularly you because you've been health minister? You handle the swine flu, and get in touch yourself with Satyendra Jain and say, look, let's devise ways of organizing jointly mohalla meetings so that we can inform people face to face. Let's devise ways of circulating leaflets door to door, particularly in slums and jhuggi jhopri colonies where people are most affected. Will you put politics aside and share that experience with Aam Aadmi?
This is a public comment sitting on a television studio. I would be too willing, and I can take the initiative myself. But at the same time, a small suggestion. That is another issue, this is another issue. We still have to address the mosquito menace. Even if we do it now, sanitation, drains,
I'll come to that more time. But the first point I want to do is, you're saying to me as former health minister, you're willing to put politics aside,
of course,
pick up the phone, talk to Satyendra Jain and say to him, look, let me help. We will together, your party in mind, organize mohalla meetings, organize locality meetings so people are informed by us what to do, how to behave. You'll do that?
I would do it if it's acceptable to him.
Let's leave the if it's acceptable.
Okay,
you are willing to do it. You are willing to do it. You're willing to pick up the phone.
Yeah, I will do it. Even when I was a health minister, I never acted like a politician.
But you're willing to do it?
Yes.
Very quickly, I want you once again, Saurabh Bharadwaj, to give me an honest answer. If Mrs. Walia picks up the phone to Satyendra Jain and says, leave politics aside. Your party in mind will together hold mohalla meetings, locality meetings to advise, guide, inform the poor, the most vulnerable. Will he accept or will he play politics?
No, I think it's always welcome, any kind of experience. I'm sure they have so much of experience in this field, and it's all welcome, and it puts such a good message to the public that politicians, leaving their petty politics aside, they are doing this thing just for the sake of humanity, just for the sake of Delhi. And Karan, I'm so glad that I'm at your show, that you are trying to tackle panic in a way it should be tackled by the senior journalist. I'm so glad you are doing it on your show.
Thank you, Mr. Bharadwaj. You're flattering me, but all people are prone to flattery, even if it's utterly undeserved. Mr. Narasimha Rao, one more suggestion. The most powerful speaker in our country by a mile is our Prime Minister. No one has a better capacity to reach out to people through his words than he does. Why can't he devote part of his Mann Ki Baat, which is probably due this Sunday or next Sunday, to this subject? To talk to people about those issues of hygiene, cleanliness, with specific regard to mosquitoes, not Swachh Bharat, but with specific regard to mosquitoes, how to avoid mosquitoes, how not to leave water in open spaces so they can breed. Also, talk to them about dengue, the fear, the panic, what they need to do. He can, as an elder and a very good speaker, reach out in a way no one else can. Why doesn't he do it?
But Karan, all your well-meaning suggestions have already been implemented. I think a Prime Minister devoted considerable time to specifically dengue and how to prevent it, and how cleanliness, how ensuring that no stagnation water in the house or nearby can prevent dengue. This was a subject that he covered earlier, and if the situation should warrant, I'm sure he would possibly consider speaking about it again. But you see, this is a crisis where all institutions have to work together. I think the primary responsibility rests with the state government, but the center and the corporations will be available to lend a helping hand, to lend all the support that is required, so that the state government can fight this crisis. This is a crisis that could have been avoided, but now that we have it on our head, we must handle it to the best of our abilities.
What a wonderful thing it is when politicians across party lines drop their opposition to each other and are willing to cooperate for the people of India. It's heartening to hear all three of you say that today with dengue in mind. It would be so nice if your leaders could say the same thing with the economics and politics of India in mind. Maybe the small lesson we're learning this evening could expand into a bigger one for India as a whole. My thanks to all of you for joining me. We began on a very depressing note about an epidemic, but we end on a much more heartening note where politicians across the divide are willing to get together for the good of the people of Delhi. If you have been, thanks for watching. Goodbye. Good night.